Okay, welcome to the coronavirus update at Montecedro, brought to you by Dr. Zajdowicz Squared. Hi, I'm Dr. MZ, and my partner in crime here is Dr. TZ. We're going to use the question and answer format to give you the latest information you need to know regarding the coronavirus pandemic.
Okay, well, we'll start with Dr. MZ, and can you give us the most up-to-date status regarding the pandemic?
Well, unfortunately, I don't have a lot of good news. The interesting thing is the pandemic is progressing exponentially. The numbers are indeed increasing. There are more than 6,000 cases reported with greater than 110 deaths. But given the difficulties that we're having with testing, those numbers are highly unreliable and are probably less than what is really happening. Everyone is advised not to get a test now if they're asymptomatic, and that means that there are probably lots of people who indeed have coronavirus infection who are not being tested. In addition to that, we now know that the coronavirus survives on hard surfaces for days and possibly remains in the air for up to 3 hours. So still our only serious weapon for dealing with this infection is social distancing. And that social distancing measures that have been put into place have had a profound economic and social effect on all our lives. They have put businesses at risk for bankruptcy, particularly in the airline, the hotel, the cruise, the small business industries, and it is now predicted that unemployment may reach 20%. This unfortunately means that a recession is likely. In response to this, our government has implemented something they call 15 days to slow the spread, which is shown on this handout that they're providing to everyone, and everyone is encouraged to go look at it at the coronavirus.gov website. So, Dr. Cheesy, are we going to be doing more coronavirus testing? Can I get a test in Los Angeles County? And what does it take to get a test?
Well, the testing remains problematic throughout the United States. I got some figures this morning, and I will tell you that the figures change on an almost hour-by-hour basis, and they vary a little bit, obviously, from the site where you take the figures from. As of this morning, the official CDC count was that the CDC had tested about 4,200 plus people for coronavirus, and other United States public health laboratories, such as California Department of Health and LA County, had tested over 27,000. Another site pointed out that we have had a total of 58,000 people tested in the United States, while another site said it's probably closer to 75,000. So there's variation depending on where you look, but probably the range is in the 70 to 75,000 tested thus far in the United States. We know that we've had about 7,500 of those people test positive across all of those particular laboratories, and about 115 deaths to date in the United States. Now, in LA County, if you look at LA County, they are still using a fairly restrictive set of criteria to allow a coronavirus test to be performed. As an example, one of the criteria they have if you have fever and a cough is that you have to have traveled to some place where coronavirus is occurring. Well, my argument would be coronavirus is occurring right in our backyard, unfortunately. So for LA County, if you go through the public health laboratory system, your doctor has to order the test. They have to go through that system with the public health people and the laboratory, and then jointly a decision is made as to whether you qualify by their criteria to do a test. There are tests coming available at private laboratories such as Quest and LabCorp. Those again require a doctor's order. And the delay in getting those back thus far is about 3 days, plus or minus. So unfortunately, the situation with testing is not great.
So, Dr. Teasy, that doesn't sound great. Is there a vaccine on the horizon? Will we get a vaccine to rescue us from this mess?
Well, that's a very good question, and I think the news there is somewhat mixed. The good news is that there are a larger number of governments, universities, private companies, research institutes that have begun to publish the start of their vaccine work. So you can see that there are many, many vaccine candidates of various types that are already being announced. As of yesterday, the National Institute of Allergy and Infectious Diseases at NIH in Bethesda, Maryland, went ahead and started a test with a messenger RNA virus from Moderna in Connecticut. The site of that test is Seattle, and this is a small test. It will involve about 45 subjects, and those subjects will be healthy people who have volunteered to take this particular vaccine. This is a phase 1 test, and as we discussed in our original presentation on coronavirus, please remember that vaccine testing and development takes time. Phase 1 tests are small, usually done on anywhere from 40 to 80 people. In those tests, you're looking for the safety of the vaccine. The first doses of this vaccine were administered, and we have to wait probably about 2 months before the safety data is collected and analyzed and reported. So that would put us, this is March, that would put us out into May to get that phase 1 testing result. After phase 1 testing, phase 2 testing in a larger number of people, usually numbered in the hundreds, would occur. That would also happen in places where coronavirus is known to be a problem. And then finally, after that testing is done, you get to what's called phase 3 testing, very large testing with thousands of people. So unfortunately, the good news is there are lots of vaccine candidates that are kind of, I would say, coming out of the woodwork. The bad news is, again, because of the needs for safety and the needs for assessing the ability of those vaccines to actually provide protection, that data is going to take a while to accumulate and then a ramp-up process to actually deploy vaccine. So my own feeling is that when Anthony Fauci says it's going to be a year to 18 months, I would listen to Anthony Fauci.
Thanks, Dr. TZ. And the next question is also for you. Are there any COVID-19 therapies that look promising?
That's also a great question, and compared to where we were when we talked about this originally, again, the news for this is sort of coming out of the woodwork. There are a variety of antiviral drugs. One that was engineered, as we talked about originally, for Ebola virus back about 2014, which is now being tested for coronavirus in both Wuhan, China, and a trial that is beginning in Nebraska, at the University of Nebraska. These are people who are infected and in the hospital and quite ill with coronavirus. There are a variety of other antiviral medications. Some of them have been used for flu, some of them have been used for HIV. They have been used thus far in what I would call a totally clinical fashion. In other words, somebody feels, well, I have a very sick patient, I want to treat them with something. That's very compassionate in its own way, but you never get good data that way to know whether the drug really worked or didn't work. There's also an effort to look at a whole variety of older drugs, not antivirals, but drugs that include things like chloroquine, which is an anti-malaria drug, a cousin of chloroquine called hydroxychloroquine, which is used for rheumatoid arthritis, older drugs that include antipsychotics like thorazine, chlorpromazine, because in the laboratory, in vitro, we can show that those drugs have activity against coronavirus. However, we don't know whether or not they will have activity against coronavirus inside a patient, and this also will require clinical trials of the same type and duration as I mentioned with vaccines. So MZ, hopefully she hasn't fallen asleep here as I've been droning on. So you've got the next question. What should we be doing to protect ourselves, and can you talk about what's new in social distancing?
Well, I'm sure by now you've picked up that social distancing remains our prime weapon. And the government has put out this 15-day plan, but I want to emphasize that this doesn't mean that social distancing only goes on for 15 days. All this means is that they're going to reassess after 15 days and decide if any more social distancing is required. So far, sick people must stay home. And if there's someone who's sick in a household, the entire household must be quarantined. Older people should sequester themselves since they are at greater risk. We need to avoid social gatherings of greater than 10 people. There should be no discretionary travel, no cruises, no social visits, no visitors at nursing or retirement facilities. No restaurants, bars, or food courts should be open. If you just went on a cruise, you need to self-isolate for 14 days, according to the Centers for Disease Control. And you may have noted this morning that the border between Canada and the United States has been closed for non-essential travel, and there's consideration of closing the southern border as well. And so that brings us to the question that's on everybody's mind. Nobody's enjoying this. This isn't fun. So how long is this going to last? I wish I knew the answer to that question. It's an excellent question. It's likely that this kind of need for social distancing is going to go on for months to maybe a year, perhaps more. There is concern that if social distancing measures are lifted too early, that coronavirus infections will rebound. And in fact, it may turn out that social distancing measures are lifted and monitoring will go on. And if the virus reappears, they will be put back into place at that point. The good news is that in China and South Korea, the number of cases are clearly falling, and they are beginning to relax some of the measures that they have put into place, although they too will be monitoring to make sure that a rebound effect doesn't occur. We really do need a vaccine. However, we also need information about what immunity this virus looks like. Does it last? Does it really prevent infection? And that's something that's really tied very closely to the use of the vaccine, because the vaccine is supposed to induce immunity as well. So I would encourage everybody to think about how to live your life differently right now. And that is, think about how to live it in terms of my social activity is going forth online. You may want to use modalities like Facebook, Instagram, WhatsApp, Twitter, Zoom, FaceTime, all of them to interact with your family, friends, see what your grandchildren are doing, and to keep your familial and friend relationships going. And we look forward to meeting with you next week to talk about the coronavirus update again.